To Mahashi's Global Family Chat on the 23rd of June 2011. Today it's our very great joy to welcome two great researchers in the field of brain and cognition. The first is Dr. Serena Grosswald, who has a doctorate in education and who is Executive Director of the Office of ADHD and Learning Differences with the David Lynch Foundation. And later on, Dr. Fred Travis will be joining us. So to begin with, Dr. Grosswald, you are involved with the ADHD research in the schools funded by the David Lynch Foundation, and there is very interesting research being done and results coming out. Please go ahead and update us.
Jay Gurudev, thank you, Dr. Swan, for having us this afternoon. Yes, we are about to have published our second study that we've done on TM and ADHD. Our first study, some people may remember, came out now a little over 2 years ago. And in that study, we saw significant reductions in stress. And with reductions in stress, we saw improvements in the symptoms of ADHD. And now we're getting ready to have our second study published, and I'd like to thank the David Lynch Foundation for supporting that study. It gave us the ability to do this second study and to do a randomized controlled trial, which gave us the opportunity to do two groups, a group that learned TM and a group that didn't. And I also especially want to thank my colleague, Dr. Travis, for his willingness to be part of that study that allowed us to show some very objective results in what's happening in the brain, as opposed to what is usually used to measure progress in ADHD, which is subjective inventories. If I could have the first slide.
What is ADHD?
Right. Yeah, so what is ADHD? It's a very common term these days, and some people ask sometimes what is ADD versus ADHD. They're the same thing. It's the terminology that's used today is ADHD that encompasses ADD and ADHD. And it's essentially an impairment of executive function, that there's some impairment in the brain, in the frontal part of the brain. And Dr. Travis will talk a lot more about that when we talk about the EEG results of the study. And that's generally considered to be the result of slower brain development. Given the opportunity, many of these children who have ADHD will actually develop normally over time. It's just that their development is slower. It affects about 8 to 10% of children worldwide, ages 4 to 17, in that age group. And the number of children affected by ADHD is growing every year. Every year a report comes out and the number of children diagnosed with ADHD is higher than the year before. So I mentioned that ADHD is impaired executive function. Well, what exactly is that? What does that translate into? Well, the prefrontal cortex is the front part of the brain, that part kind of behind the forehead there. That's responsible for executive function, which is this higher order functioning of the brain. With respect to ADHD, it's related to attention and focus, memory, planning, organizing, impulse control. So these are the symptoms that we see with ADHD. Obviously, difficulty maintaining attention and focus. They also have trouble with their working memory. They tend to forget things very quickly, and that's why they have to be told things many times. That's why it's such a problem with learning. Combination of not being able to keep their attention and focus and not being able to remember makes it pretty hard to learn. They also have difficulty with their planning and organizing. They forget things. They don't know where things are. They forget that they're supposed to do certain work. And obviously it's, again, difficult in trying to get schoolwork done. And then impulse control. especially a problem with the children that are hyperactive. ADHD is attention deficit hyperactivity disorder. So it can be ADHD hyperactive type or ADHD inattentive type, but it's all ADHD. And so they have difficulty controlling their impulses. Dr. Travis will talk a little bit more about that. Why is it that they can't control their impulses, and the relationship between that and the prefrontal cortex? So as I mentioned, our first study that came out a couple of years ago, that it actually was surprising to me that we know TM's benefits in reducing stress and anxiety. We know that very well. But I didn't really associate it with ADHD. But what we found was that with the children that learn TM, and of course one of the things that people say right away is it hard for children with ADHD, especially the hyperactive type? Is it hard for them to do? Is it hard for them to learn? They have trouble paying attention, keeping their focus, remembering things, and then they move around a lot, and they're very fidgety. So can they actually sit still and learn TM and practice it? Well, what we found was absolutely. Because TM doesn't require that attention or concentration or focus, it's very easy for them to do. And they experience their own mind in a very quiet state, which is something brand new for them. I'll never forget the very first student that learned in our first study. And so I asked him how he felt now that he just learned. And he said, I feel like it's a whole different world now. Because for the first time, he really could experience that quiet, that silence. And though children meditate differently than adults, their nervous systems are a little different anyway, so they move around a bit during their meditation. But what we found was that these children were able to sit, meditate. They could even meditate in a group and did very well with it. So we saw with that group very significant reductions in stress, 50% reduction in stress, and I'll talk a little bit more about that later. But that sort of gave me pause to start to think about the relationship between stress and ADHD. And so when we saw those results and we saw their ability to manage their behavior and organizing and that sort of thing, I wanted to be able to show something very objective, because most of the measures for ADHD are subjective measurements. So I wanted to be able to show something had to be going on in the brain. And so I called on Dr. Travis, the expert in that area, and asked if he would help with this study. And very graciously, he agreed. And if I can have the next slide. The study was done in a school in the Washington, D.C. area. That's a school for students with language-based learning differences or learning disabilities. That means that they have difficulty with reading and writing skills primarily, but generally most of the students had difficulty with pretty much all aspects of learning. So they already had some learning differences. And then on top of it, the group that we worked with also had ADHD. So we randomly assigned a select group of students. These were ones that had already been diagnosed with ADHD and other related disorders like high-functioning autism or Asperger's. Some people may have heard of that and ask whether or not TM works for those disorders as well. And though we haven't specifically looked at that yet, but we will. We did collect data on those students the next year, and with the help of Dr. Travis, hopefully we'll have some new light to shed on that sometime soon. But these children were middle school age kids. They were aged 10 to 14. We started with 20 students. We actually started with about 24 students. But 4 of those students, their parents didn't want to take the chance that they might end up in the control group and that they would have to wait 3 months before they could learn TM. They wanted their children to learn right away. So we have results on those students separate from the ones that were randomly assigned to either a TM group or to a control group where they didn't have any intervention. And we did, in addition to the EEG, we also did cognitive tests measuring some learning performance, self-reports by the children and the parents using some of the same instruments that are used to diagnose ADHD, and then, of course, the EEG measurements. So to explain what we saw with the EEG measurements and what that translates into, I will turn it over to Dr. Travis.
Thank you very much, Dr. Griswold. Thank you also for the very clear, succinct definition of what ADHD is and what its manifestations and problems are. One thing you brought out is that ADHD is a developmental disorder. And specifically, it's a lag in 3 or 4 years development of the connections between the motor system of the brain and the frontal areas of the brain. And what this means is when those are not mature, the information goes very slowly over those spheres. And you can see this with the whole diagnostic of what we see, that someone with ADHD lacks impulse control. They can see the world, they can imagine the world with the back part of the brain, they can come up with an idea of what to do, but the connections with the front are traveling so slowly, they never can put it into a larger perspective. And so what happens is they act and then they realize what they've done. Now what's of interest is these 2 aspects of ADHD, attention deficit and hyperactive disorder. What's found is most students diagnosed with ADHD, the hyperactive disorder, they tend to grow out of it. Another way of saying it is they're doing things during the day to allow them to modulate and control their motor behavior. Just stopping at a stop sign and stoplight and letting the cars go by. Frontal lobes have to the motor system to stop. And so what research shows is if you're diagnosed with hyperactive disorder at 10, you naturally grow out of it. But what is also found is if you're diagnosed with attention deficit at 10, you don't naturally grow out of it. However impacted you are by attention deficit at 10, that's what you'll be at 15, 20, 25. And I think the reason is there's not tasks during the day which just exercise our attentional circuits, except for transcendental meditation. I think this is why we found what we did find with these individuals. Let's go to my first slide, our first slide. What we're seeing here is a measure of brain function, and it's a composite measure. So we see some words, theta and beta. Those are different brainwave frequencies. What's seen in someone with attention deficit hyperactive disorder is they have very high levels of theta activity. What theta is a frequency that the brain uses to block out irrelevant stimuli. People with ADHD have higher levels of theta EEG than the normal person. And what this does is it blocks out relevant as well as irrelevant information. So one marker of ADHD is the amount of theta relative to the faster frequency, beta, which is what allows you to focus. And what we see here, we see the pinkish square and then the purple diamond. We see that a pretest, both the experimental and the control subjects, are quite above the normal range. The normal range is the line there. And then the TM group learned TM right away. The delayed start had to wait till after the 3-month post-test. And so the second line, the second 2 points there, are what is the theta-beta ratio after 3 months? And we see that the TM group, this brain marker of severity of ADHD symptoms had come closer to more normality. The control group went up a bit. It's not statistically significant, but they definitely did not improve. Now, the control group at that point learned TM, and so at the 6-month post-test, both groups have been practicing TM for over that time. And we see that this brain marker severity of ADHD symptoms has gone towards normality. So this is one finding of brain changing. And again, why? I think the why is just that during transcending, what we find, a new study just coming out now on neural imaging during TM, the frontal areas, the executive portions of the brain, are more active during transcendental meditation practice. So that means you're as if exercising your executive circuits during TM, so after meditation, they're more available. This is looking at coherence, and these are coherence difference maps. And what you see is the difference in coherence from baseline to the 3-month post-test. The top row is the control group, and they just continue to do what they do. They didn't start meditating. They just had their usual curriculum at school, usual maturation that's going on. And we see very few differences in coherence. The middle group is a TM group. So now we're seeing what's the effect of 3 months practice of the TM technique. The 4 columns that you're seeing are different frequency bands. The one to the left is theta, the second one is alpha, the third one is beta, the fourth one is gamma. Theta is, as I say, the ability to focus. Alpha is inner wakefulness, that's the second column. The third column, beta, is just task processing, what the brain has to do to get things done. The fourth column, gamma, is very focused task processing. And what you're seeing in all of the frequency bands, the brain is working more as a whole. It's less fragmented. And that's the issue with ADHD. In ADHD, the back part of the brain is functioning fine, front part of the brain is not functioning. It's as though an ADHD is like a business without the boss. And all the departments are going full speed ahead, but they're not aware of what's happening in the larger business. And what we're seeing happening here is by strengthening integration in the executive system, now that part of the brain can organize and direct the whole brain. The bottom row here is in the control group. So what changed from 3 months post-test, and then they learned TM, and then it's 6 months post-test. So they've been meditating also for 3 months. And again, we see the high increase in global coherence over the whole brain across different frequency bands. So these are some of the brain changes that we've seen. I'll give it back to Dr. Grosswald to tie it up with some of the psychological tests. Thank you very much.
Pardon my asking, but I could not quite understand this chart. Can we see the chart again, please? Thank you. We have control group, TM group, and control group 3 months to 6 month post-test written down the left-hand side. And
excellent.
And then we have these 4 rows, as you say, or 4 columns and 3 rows. But then you also have control group in the first column, control group at the top, then TM group, then control group again. So how do these... okay, so the top group is the control group all along.
Exactly.
Is this an average of all of the students, or is it just one student as an example, or?
These are very good questions, Peter. The top row is the average of the control group. So that's the delayed start group who did not meditate over this 3-month period. And it's asking for the change. What changed in the coherence at 3 months relative to baseline?
Okay.
And what we see in that top row is there are some changes, but they're very few. And then the middle row, we see the title row is TM group coherence during 3 months post-test, mining coherence during pre-test. So this is saying in the control group, in the TM group, so that's the group that learned TM immediately, what changed in their brain from 3 months from the pre-test.
Okay.
So these first 2 rows are actually comparing the same time periods in terms of months, but the top row, the control group, hadn't practiced TM. The middle row, the TM group did.
Okay. And this again is an average of all the students, all the
Exactly.
TM group students.
Exactly.
Okay, wonderful.
And then
Good.
the bottom is looking at the control group. So it's the next 3 months of the study, the last 3 months of the study, just looking at the control group. How did their brain change once they learned TM?
Good. So,
So
good, good, good.
what it's replicating is the effect of 3 months TM practice on changing brain functioning and to allowing the brain to begin to function more as a whole.
Interesting that the control group in the after they had learned TM didn't seem to do as well as the first TM group.
That's true. It wasn't statistically significant.
Not.
But the key point is they were significantly different than themselves for the previous 3 months.
Well, clearly those two parents who took their children out of the control group were absolutely right to do so.
I'm sure it was mother's intuition that told them what to do.
Nothing wrong with their EEG.
Exactly.
Good. Thank you very much, Dr. Travis.
Thank you, Peter.
Absolutely wonderful.
Thank you very much, Dr. Travis. A really very clear explanation of what we were seeing there. One interesting thing that we did find, I'm not sure what you were, Dr. Swan, you were mentioning something about how one group did versus the second group. One thing that we noticed was that when the second group learned, the effect of both groups was actually greater. There was some effect of having, as we know, the superradiance effect. When there were twice as many meditating, the actual amount of improvement was greater in the last 3 months than in the first 3 months. That isn't something that we actually wrote up in the paper because it wasn't statistically significant, but I just think that's an interesting little fact there, and shows the benefit to an entire school when we bring a program into the whole school like that. So we did a little bit of, as we mentioned, some cognitive assessments. So we can see clearly what's going on in the brain. There's something very, very definite going on in the brain. And one thing, when I show these slides, I often get comments from the audience where people say, well, we can't see some of those lines, especially in the control group. Well, those lines reflect the intensity of the amount of brain functioning. So in the control group, those lines are very light, where in the TM group, there's a lot of red there, which means that it's a high intensity functioning there. So what does that translate into in terms of practicality, in terms of schoolwork, in terms of learning? So we also incorporated some cognitive assessments, kind of paper and pencil or verbal assessments. And one of them was word fluency. We saw statistically significant improvements in word fluency, improvements in their language-based concept fluency, and their ability to shift from one concept to another. So I'll tell you a little bit about what these instruments were. The word fluency, or the verbal fluency test that we used, it asked them to say as many words as they could think of that started with a particular letter. So if we said the letter is B, list all the words that you can think of that start with B. And unfortunately, it's very difficult for them. And we found improvements there. And what that means is it's a higher order learning. It doesn't sound like it's something very difficult, but it actually is higher order learning because it requires that they, pull out of their working memory words that start with a certain letter. They have to be able to process it and make sure that it's not just something that sounds like it. And there are certain rules about what forms of the words they can use. So it actually requires higher order learning or problem solving. And the other is another aspect of that test where they're asked to alternate between the name of a person and the name of a vegetable, or the name of a musical instrument and the name of a piece of furniture. And that's really hard because they have to think up different pieces of furniture or different musical instruments, and they have to be able to switch back and forth. And that aspect of switching is difficult for children with ADHD. They don't have that mental flexibility. So the ability to switch back and forth is important. So we can see what are the actual practicality of the changes in brain functioning that we saw. So what that translates into is what the parents were seeing, which was improvements in their ability to focus on their schoolwork. These are questionnaires that we had the parents fill out, and these are common instruments that are often used. Plus, we had, in addition to that, a questionnaire that we created, and they saw improvements in their child's ability to focus on their schoolwork, their organizational abilities, their ability to work independently, to sit. There were some students who said they were able to get their homework done, and the parents were saying, yes, they're able to get through their homework easier and faster. They were happier. They actually liked school better. And they had improved quality of sleep, which is huge because, the children today have so much stimulation that they have a lot of trouble sleeping. And they often don't go to bed on time either. And the results of lack of sleep are very similar to the symptoms of ADHD. So sometimes just getting a good night's sleep can affect the symptoms of ADHD. So many of these kids were sleeping better, didn't have to use sleeping aids. Very early on in the beginning, we had one student who, in the first week or so, we were asking him how was he doing with his TM, and did he notice any changes? And he said that he was having nightmares almost every night, and that he was having fewer nightmares. After a month or so into the study, he wasn't having any nightmares. And we would ask, do your parents notice any difference? And he said, yes, my parents are really happy with me because I'm doing all my chores. And I said, well, is that because you enjoy doing them now, or because you have more energy? What he said, it's because I have more energy because I'm sleeping at night. So just even that small thing can make a big difference in their performance. So we asked the children themselves several questions about their experience with TM. We asked, of course, is it easy to do? And they all said it was easy to do. They noticed for themselves that they had better attention and focus in school as a result of being able to pay attention more. They found that they enjoyed school more, that they suddenly found that their teachers were more interesting. I mean, the teacher doesn't change, the school doesn't change, but their interest and their enjoyment in school changed. They found they got along better with their friends. Some of them made friends who were a little bit more not as socially adept, and as we mentioned before, that they were sleeping better. So those are just some of the things that we saw as the result of the changes in brain function. So we can see that there is something very profound happening with TM, that we see improvements in learning, improvements in executive function, that is very measurable in looking at what's going on in the brain.
Dr. Grosswald?
Yes.
This is just wonderful to see this beautiful change for the students, and what a relief for the parents and for the teachers to have this improvement going on in these children who are struggling themselves and must be very difficult to manage at home and at school. And we see that from Dr. Travis's work, the basis is, if we could say, the connection between the front, the executive of the brain, and the back is being restored, or is being formed for the first time, and the brain is able to function as more as a whole, front and back. And I wanted to ask how important is this study? Have any other studies been done that combine this sort of EEG research on ADHD sufferers? And what have they showed?
I should have that on the tip of my tongue, but I do not, Peter. There have been other studies with EEG, and actually there's a number of different brainwave subtypes which have been identified. Some high theta, some differences in beta, and so on. But in terms of effect of a meditation technique for ADHD. I'm not aware of any other studies. Do you know of any, Dr. Grosswald?
I'm not aware of any that have looked at EEG or yeah. I mean, there are other studies that have been done on meditation in ADHD, but I haven't seen any others that have looked at EEG patterns.
So does this put transcendental meditation in pole position for handling ADHD in students?
In a racing terminology, I guess it does. But I think what's most exciting is people are aware of the need to look beyond pharmaceuticals to deal with ADHD.
Good.
I'm beginning to see that it's a larger issue. It's a developmental issue, and it's not like a disease where if you have the flu, you get a vaccine and it stops the flu. But this is more of a long-term developmental point, and it's taking many things. It's taking curriculum, it's taking patience on the level of the parents. And by transcending, it gives that necessary hidden engine which helps the student be able to control themselves. And when the parents meditate, it's also so great for them, because ADHD children, I find, are very curious. They're very energetic. Being a parent of an ADHD child must be very trying. They're constantly asking you questions. They're constantly doing what you expect them not to do, or hope that they don't do, but they do. So the whole use and exploration of meditation techniques, I think, is a very important area for treating ADHD.
I'd like to add, the question about whether there had been other EEG studies. I mean, I haven't seen other EEG studies looking at meditation. There are a lot of EEG studies that are done with the use of biofeedback or neurofeedback. And it's an interesting comparison to make between these two, because, and Dr. Travis can probably talk a little bit more about this too, but with the neurofeedback, what you see is that they're working specifically on particular bandwidths. So they're trying to work on that theta-beta ratio, on focus and on relaxation. But it's, a small part of the brain. It doesn't result in that whole brain functioning that we see. And it's also requires all this equipment to do it. It requires many sessions. And when somebody spends an hour doing that, they're tired. Where TM is the exact opposite. It's easy. It doesn't require all that equipment. And when you're finished, you feel refreshed, and you're affecting the whole brain. And though I only have anecdotal evidence of this, that parents who have done neurofeedback with had their ADHD child do it, is they say that the effect is, well, one parent described it as it maybe made a 5% change, where the effect of TM is significantly greater and very noticeable to the parent as well as the child.
It's an excellent point, Dr. Grosswald. I remember looking at the data on Neuroscan, which, as you say, you go 40 or 45 sessions, and they did find changes in theta-beta ratio, but it was on the order of a decrease of 20 or 30%, where our 3 months TM practice led to a decrease of 60%. Mm-hmm. Simply because what the transcending is doing is it's targeting the attentional circuits. It's allowing those to become more integrated. It's a whole idea of use it or lose it. And as you exercise those parts of your brain, you're also exercising those abilities to think and consciousness, and then they become more available very naturally.
And Dr. Grosswald, are you aware of any other research showing the subjective changes and the practical changes which you have outlined, the word fluency and language-based concept fluency, better sleep, happier, work independence? Is there anything that is comparable?
Well, there have been some studies, not very many, but some other studies on meditation and ADHD. And they found some improvements on some of the cognitive things. What's interesting is that, at least for children, they didn't see the reductions in stress that we did. They saw some reductions, but it wasn't statistically significant. And in our previous study, where we looked at specifically at stress, and we saw a 50% reduction, there's nothing that's shown that big a reduction. If you were looking at a study for a drug, for example, and there was a 10% or 15% reduction in symptoms, you would think that this is significant. Let's get out there and market it. Mm-hmm. If you saw a 25% reduction, it would be headlines. And we saw 50% reduction in our previous study. So I don't think that there's anything so far that has shown the substantial changes that we have. But the one caveat that we have to make is that there needs to be more studies, larger studies, so that we really can make these statements very definitively. But I think when this study comes out in September, it should definitely raise interest, that it will get people's attention, I think, because of the significant results that we see.
Beautiful. So this seems to be a completely new door opening for the for growing students out of ADHD in a very natural way, allowing them to take up that development which they are a bit slow on, and to grow into a much more satisfying and healthy and productive level of functioning.
Yeah, I just would like I'd like to just tell one quick story. This is from a student that was in our first study, actually, in line with what you said, Dr. Swan. We recently did a video interview with him. Now, 6 or 7 years later, he's now 21 years old. He was 14 or 15 when he was in the first study. And so it's wonderful to see him this amount of time later. And this was a student who very much was a loner. His social skills were not developed, and he didn't have a lot of friends. And he started TM, and he was very good about it, and continued on even after the study was over and we were no longer in that school, and he continued. And he became president of the student body of his school in his senior year, became a student leader, and then in college was in student government there. And so, and now has a management job and is doing well in the university and loves his meditation and is still very consistent. So you can see it's so fulfilling to see the change in this middle school student to what he became as a young adult.
Beautiful. So this is just wonderful, and great congratulations to you both. Dr. Grosswald, it's just great that you're opening this door and facilitating the huge relief for the students, the young, the children, and also the parents. And Dr. Travis, do you have any closing remarks?
I just would like to join you with saluting the work that Dr. Grosswald is doing. She's a lioness in the world of consciousness-based research, and she is single-handedly dealing with some of the largest knots of stress, ADHD in children, PTSD in adults. It was a joy to work with her, and I hope that we can continue to work together in many different venues, Dr. Grosswald. Thank you.
Thank you very much.
And Dr. Grosswald, any last thoughts before we leave?
Just to say, the same goes back to Dr. Travis. This study is going to get the attention that it will because of the brain work that he's done and his participation on this study that really puts us in another realm. And yes, I look forward to more work together.
Wonderful. This is great to hear, just great, because well, looking at it from an outsider, a picture is worth 1,000 words. We had a couple of pictures there, and so you've got a lot of extra ammunition there. That's going to be very powerful. So congratulations to you both. Thank you very much for joining us this evening, and we look forward to the publication of your paper and to seeing that coming out and really opening the door for teachers, for educators, for parents, and of course for the children worldwide.
Jai Gurudev.
Jai Gurudev.
Jai Gurudev.
Jai Gurudev. And we end by ringing the bell of invincibility for all the students to grow out of this little developmental lag and to find fulfillment as that young man did who you described to us, Dr. Grosswald.